Live from the French Quarter, this is Eyewitness Morning News.
Thank you, Laura. Despite the high occurrence of conditions like heart disease and prostate cancer, men are less likely than women to visit a physician. This Father's Day, give your dad the gift of health and remind him to visit the doctor. Dr. Frank Smart of LSU and People's Health is in today to discuss some of the common and potentially preventable conditions. Dr. Smart, this is a very appropriate time for you to come in because it's often the wives or the women in men's lives that will get them to the doctor.
Exactly. Men don't go to the doctor unless something very serious is wrong, and usually late stage or prompted by the women in their lives to go. And so that's the reason this Father's Day, it's important to try to get the message out that what a better gift than to make your father go to the doctor and tell him you want him around longer.
Yes. And now we'll talk about some of these illnesses that people may notice. If the man in your life snores constantly and loudly, that can be a sign of a serious problem.
Obstructive sleep apnea is a very serious problem and unfortunately under-recognized and grossly underdiagnosed because everybody thinks snoring is not a big deal. Snoring when you actually stop breathing, like in sleep apnea, is a really big deal. It contributes to hypertension and stroke and heart disease and heart rhythm disturbances. It's worse when you're obese or have a really thick neck, sleep on your back, and some people notice it's periods of where they look like they're breathing but they don't make any noise and then make a loud snore.
And this condition is treatable. If caught in time, it can be treated. And also we want to move on to lower back pain. And what are some of the conditions involving lower back pain?
There are congenital things that can be wrong with someone's back, but most of the time lower back pain is a problem with mechanics. And that is people trying to pick up things and not using the appropriate leverage, and using their back to pick it up instead of their legs. Many times people will be involved in an injury, an automobile accident or some such thing that results in low back pain. Those types of things, exercise, weight loss, particularly if you have a big abdominal section, are going to help low back pain tremendously.
And some other things that are quite common, acid reflux or heartburn.
Again, spicy foods late at night. If you're a proponent of those things, it's really going to affect you. Your esophagus is designed for moving food from your mouth to your stomach, but not for acid. So if you eat something that raises the acid in your stomach and lay down, it washes back in your esophagus, and we call that GERD.
And something that people may not know is that 1 in every 6 men will be diagnosed with prostate cancer.
Exactly. And particularly as men are getting older, it becomes much more frequent. It's good because the survival can be 100% if caught early. And so early screening is important as well.
And the leading cause of death in men is heart disease.
And is still the leading cause of death in men and women, and it's a huge problem, particularly in our area, with genetics, lifestyle, and cigarette smoking. The things that you can do about stopping cigarettes are immediate, but it's also very good to know what your cholesterol and your blood pressure numbers are, and if they're elevated, to have them treated.
And it's also important for men to have the colonoscopy on a regular basis because that can zap polyps that can cause colon cancer immediately.
Absolutely. If you have a family history of colon cancer, you should be screened early and should follow the recommendations of the gastroenterologist. If you don't, you should be screened at 50 and then every few years after that. It is totally treatable if caught early.
So when you go into the doctor's office, give us some ideas of some questions you should ask your doctor.
Well, I think that you want to walk out with a sense of you want to know what your numbers are. You want to know what your blood pressure is. You want to know what your cholesterol is. You want to know what things that you can do from a standpoint of reducing your risk. You want to get an exercise prescription if you don't exercise routinely. Exercise is incredibly important and can make a tremendous difference in all of the things that we've just talked about.
And exercise can mean just going out for a walk for 30 minutes each day.
Absolutely. It needs to be brisk and it needs to be continuous. Most men think that because they're at work and they walk around a lot that's exercise, but it's not. It's 30 minutes of continuous activity for 3 to 5 days a week.
All right. Well, Dr. Smart, some good information on this upcoming Father's Day. Appreciate you being here.
Thank you.
And if you would like more information on the easy tips that spouses and children can remind fathers of this year, you can call People's Health at this toll-free number. It's 1-800-978-9765, or go to our website, WWL-TV.com, and click on links on 4.